Overdose. Drug overdose is a serious health issue in Toronto. Over the past decade, the number of people dying has risen by 41%, from 146 in 2004 to over 200 people in 2013, the most recent year that we have data. These are essentially preventable deaths, and we must do more to save the lives of these vulnerable members of our community. Supervised injection services, the subject of a report which is released today and which will be discussed by the Board of Health on Monday, is one important measure to help prevent these deaths. A supervised injection service is a health service that provides a safer and hygienic environment where people can inject pre-obtained drugs under the supervision of a nurse. Supervised injection services have been operating for over 30 years in countries around the world. There are more than 90 operating now in Europe, Australia, and here in Canada. International research has shown that these health services reduce drug overdoses, and it's not hard to see why. Injecting under the supervision of a health professional is safer than injecting in a washroom or an alley. They save lives and limit the spread of diseases like HIV and hepatitis C by reducing unsafe injection practices, such as the sharing of previously used needles or other injection supplies. Research has also shown that there are benefits for the community, that they reduce the public drug use and discarded needles associated with injection drug use, and in fact that they do not increase criminal activity in the areas where they are located.
The Toronto Drug Strategy was established in 2005, and it was part of a comprehensive approach towards substance use in our city. We look at treatment, prevention, harm reduction, and enforcement. These programs will also make our communities safer. They will move drug use and needles from our streets, our parks, our backyards, and our coffee shops, and into a supportive and safe environment. 206 Torontonians died of overdose in 2013. It's a painful number, and these deaths are preventable. In more than 90 sites around the world and in Canada, supervised injection services work. They work well. They improve the health of those who use drugs, and they improve the safety of the surrounding community. It is time for the City of Toronto to act. We can and we must.
So once you have your drug in there, you would swab your site and you would tie off. So you would pick your vein, you would tie off, and you would inject intravenously. And then once you were done the injection, you would dispose of your needle.
We waited a long time to have this come to fruition. It's a wonderful idea. It keeps the community safer, it keeps everybody safer, it keeps people who come in to use the site not only come in to inject, but they also have access to other resources, referrals for other situations that they might find themselves in. And overall, it's a wonderful idea, and it's an idea whose time has come. I have no doubt in my mind it will make the community safer.